A review of drug treatment services in northwest Tasmania has recommended extra rehabilitation beds as a high priority. The Health Minister, who's rejected fears of an ice epidemic, says he'd love to fund them immediately, but money's tight.
The Circular Head community has been rocked by reports of an ice epidemic among young people. It sparked a government review of drug use and treatment services.
The increase in use cannot be considered as being at epidemic levels. It appears that the increase is occurring across Australia, but this is not a problem limited to the northwest community.
The review found the self-reported use of any form of methamphetamine in Tasmania had tripled over the past 3 years. The use of the crystal form rose from 5% in 2010 to 21% in 2013. The review also found a 49% increase in the distribution of syringes in the northwest over the 3-year period. However, some statistics aren't reliable due to a low sample size.
The department made it really clear that data in this area is inadequate and in some places wholly non-existent. So we actually don't know what the level of ice use is in any part of Tasmania.
The review has recommended more education and training and increased access to rehabilitation beds. There are currently no publicly funded beds in the northwest for recovering ice addicts.
I would dearly love to announce today that we will immediately fund those proposed new expenses, but unfortunately, the member asked why aren't you, Madam Speaker, unfortunately we were left a budget mess.
There's a lot of services that need the support of the government, but I'm thinking that this is going to be a crisis if we don't do something about it.
The Minister insists he'll work hard to implement the recommendations over coming months.
The issue that we have, of course, if people continue in drugs, they become useless for our community because they don't work.
With the northwest already having the highest youth unemployment in the nation, it's hoped the government finds the money fast. Anna Fromberg, ABC News.